So really with all three of the major antifungal buckets, there's lots of crosstalk and overlap in terms of what they treat. But in
Right.
general, when it comes to azoles, you have your old version of azoles. We dial back to the ketoconazoles and the fluconazole. Those were some of the early azoles. Those only covered yeast. That was it. It was just yeast. And then you get into the itraconazoles and now later vori, posa, and isavuconazole. Then you add to the yeast coverage mold.
Mm.
Okay, so those early ones never had mold activity. So we are never going to treat a mold infection with fluconazole.
Right.
Doesn't work. But the later azoles, the later generation ones, definitely now have yeast plus mold. Okay, so like Vori, you're getting candida and mold. Posaconazole, candida and mold like aspergillosis. So you're getting much broader spectrum coverage with the later azoles. What are the azoles? The amphotericin, the polyenes. Amphotericin really has fantastic yeast, mold activity. It's a broad spectrum antifungal. It's just too bad it has so many side effects.
Yeah.
Um,
There's nothing it doesn't work against.
it really is rare. There's some aspergillus species that do have some inherent resistance. There's some candida species that have some inherent resistance to amphotericin, probably by virtue of lower level usage of ergosterol, where amphotericin can bind and make those membrane disruptions. For the most part, it's really fantastic antifungal agent, very broad, active against an incredible number of species.
Great.
And then you have the echinocandins. And the echinocandins, their big unfortunate gap is mold. You know,
Okay.
it's a second line agent at best for mold activity. And so there, and the echinocandin, that's your workhorse yeast. You know, it's
Mhm.
candida, it's some of the dimorphics.
Right.
Um, so that's how I think about it. With azoles, we use fluconazole a lot, and I love it for candida infections. If I need mold azole, I go right for posa or isa or vori.
Okay. Right.
Amphotericin, almost everything, but
Yeah.
lots of baggage when it comes to side effects. And echinocandins, I'm thinking them as candida. They're my
Yeah.
candida workhorse. So, we've talked about all our different buckets of like antifungal drugs, but really the best, the best agent of all, better than amphotericin, is your own natural innate immune response, and that's your neutrophil. And a neutrophil has so many effector functions to kill fungus that
Yeah.
really it's all about getting your neutrophil to be directed against fungi. So
Could you get
yeah,
Neupogen?
it's a great question. So I think if someone is neutropenic, then Neupogen is FDA approved to increase your neutrophil counts.
Hmm.
It turns out that Neupogen, which is GCSF,
Right.
granoside colony stimulating factor, also enhances neutrophil function. So, I'm not here to advocate, off-label use, but we've definitely done studies where if we take someone's neutrophils and add GCSF in a research experimental sort of
Yeah.
situation, we can see that that neutrophil functions better. It'll recognize fungus better, it'll eat it better, it'll kill it
Right.
better. So,
Right.
so neutrophils are very like they're very fluid, they're very plastic. You can have your function be on one end of the spectrum, add a few things, and see that that function can be enhanced completely.
That's
So they're
great.
they're
Not just
often
a number to make us feel
exact
good in our lab.
exactly. I mean, numbers are critical,
Lab work.
but
Yeah.
what we're appreciating is that function is just as important. So trying to one develop the tools to understand someone's nutritional function and develop the therapeutic interventions to enhance that function, I think is one of the key waves of the future, when it comes to
Yay.
very invasive infections